So hello everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey, and I partnered with them to bring you an easy and educational workday session. Today's session is all about recovery. It's recovery essentials, the importance of rest and restoration. We're going to explore the often overlooked aspects of fitness, the recovery aspect. We'll talk about the importance of rest, restoration, and achieving your fitness goals, preventing burnout, reducing the risk of injury, and we'll also go into effective recovery techniques, including proper sleep and active recovery strategies to support your overall well-being. A little bit about me. I'm a physical therapist. I received my doctorate in physical therapy in 2010 from Mercy University in upstate New York. I'm a certified orthopedic clinical specialist, certified golf medical professional, certified CrossFit coach, and certified dry needling specialist. So that's about me. Let me bring up my slides here. We'll get into our little talk. So recovery essentials here, the importance of rest and restoration. Now, because I'm a medical professional, I have to put up this disclaimer. Basically, this is not medical advice. This is not physical therapy. This is intended at a broad population, a broad audience. So if you're dealing with something specific, whether it be an injury, a pain, or whatever, make sure that you have a thorough physical exam to have your root causes addressed and get to the bottom of your issue so you can have it fixed 100%. All right? So if you've been to any of my talks before, any of my classes, this saying, this thing should be totally familiar, that if you take away anything from any of my classes, remember this, is that the body functions on this alternating pattern of stability and mobility. And if this pattern is disrupted, then pain or injury is the result. So if you're dealing with something, keep this in mind, that this alternating pattern, the video is coming up, this alternating pattern is how our body functions, all right? It's this regional interdependence. As one body part is supposed to be mobile, the other body parts or segments around that needs to be stable. So this alternating body pattern here is how we treat and how we recover and how we fix things that are wrong. So if you're dealing with back pain, make sure that your back is as stable as possible, and also that your thoracic spine, your T-spine, and your hips are as mobile as possible, because if they're not as mobile as possible, the stuff that's supposed to move is not moving well, then your body kind of unlocks what is supposed to be stable, so your lower back may become unstable or more mobile if you're losing range or have limited range of motion at your hips or your T-spine, the regions above or below. That's just an example. It happens in the shoulder, happens in the knee, so this alternating pattern, just keep that in mind. All right? So diving into muscle tissue, why is recovery so important? We need to understand what makes our body, what makes up our body, right? So if we look at this illustration here, muscles are essentially like strings, right? Or springs, interconnected springs. They shorten, they lengthen, right? These fibers need to function in a shortened position and a lengthened position to create force, movement, torque, power, what have you. But also, they're housed in what we call fascia. And depending upon where that fascia is in the body, it can be called different names. I'm going to pull this up nice and big so you can see that we have, perimysium, endomysium, epimysium, all that mysium stuff are different names for fascia. And why is this important? Fascia is basically the structure, it keeps our body together. Our muscles, all the open spots, the blank spaces in our body, that's all filled with fascia, and everything's interconnected. So if these segments, these fascial segments, aren't sliding on one another or past one another, then we typically get a lot of pain, injury, soreness, or whatever. So let's just say, for example, if you're working out, you're essentially creating some type of micro trauma to these fibers, this fascia and the muscle fibers, that in 24 to 48 hours, your body, through a chemical process and hormonal process, gets signals that it needs to repair this micro trauma. So in the end, you get stronger, faster, or lose weight or whatever. These changes in your body happen over time. And it's prompted by the loads and stresses we put on it. Now, oftentimes I get asked about, if I work out, it hurts, I get sore, right? But that's kind of like normal, but we want to look at what is a normal type of soreness after working out. How do we differentiate it from an injury? DOMS stands for the delayed onset of muscular soreness, DOMS. And that's typically happens after exercise. It happens after exercise within 24 to 48 hours and may last up to 72 hours, depending upon how intense your workout is. So with the words here, I'm just going to pull this up. So the green check marks are basically normal DOMS, where you have like an ache sensation that usually lasts within the time frame that we said, 1 day, maybe 1 week if it's really your first time, right? Or injury, the red stuff, is where things are sharp and it lasts for prolonged periods of time, and it's unrelenting. When you do stretches or take a break, it's not getting any better, right? So it worsens with stretching and exercise versus improves with stretching and exercise, okay? So those are some things that we need to keep in mind when we're going into exercise and like, hey, what's normal, what's not normal? So how do we reduce our risk of injury or reduce the intensity of the DOMS, right? So this is the 4 things that we're going to talk about. We're going to dive into sleep, hydration, active recovery, and stress management, okay? So the first thing is sleep, right? We need to be able to sleep 7 to 8 hours per night, all right? Sleep is our body's time to recover from all the stress that you've put on it throughout the day, all right? So that could be physical stress or psychological, emotional stress. We need to recover from what we did during the day. And because it's our time of recovery, we want to optimize this time as much as possible. So, posture, sleeping posture is important. We don't want to introduce any rotation or excessive side bending or anything like that, because our body adapts to that position, right? If one side is long or rotated and the other side is short, then your body makes that side short and just kind of stays in that position, and the long side stays long and loose. So we don't want to have that asymmetry. So the best position to sleep in is either on your back or on your side. I would suggest never on your stomach. And pillows, we want to have a good support for the head. People who sleep on their backs need a thinner pillow than somebody who sleeps on their side. And if you are sleeping on your side, you want to make sure that you support your lower half as well. Put a pillow between the knees so that you don't have your knees coming together, which can introduce rotation through your hips, your pelvis, and your lower back. All right? So we talked about posture. Another point that we want to touch on is temperature. The ideal temperature to sleep in is somewhere around 65 to 68 degrees. Cooler is better. And also we want to make the room dark. All right? Any light can keep you awake. It's a neurological stimulus that heightens our awareness that, hey, we need to be awake. So we want to keep it light. And also we want to avoid blue light for at least 1 hour prior to going to bed, all right? So that means no screens, phones, computers. We want to shut that down and try and wind down our nervous system so that we can get a good night's sleep. 7 to 8 hours, very important. All right, and then hydration. Hydration is the amount of water that you're taking in throughout the day. We wake up from sleep in a dehydrated state. That is automatic. We lose water through our breath, and we become dehydrated before we are thirsty. The thirst centers in our brain don't register until we get super dehydrated. So you can become dehydrated even before you get thirsty. Now, water is super important because it helps lubricate all those surfaces that we talked about, that fascia, the muscle surfaces, to help slide and make everything supple. Oftentimes, with prolonged inactivity and dehydration, these fibers, these layers can become very sticky, and they can stick together, which can cause like adhesions or trigger points or something like that. So how much water should you drink in a day? All right. You probably heard about maybe 6 to 8 glasses. I mean, that's a pretty vague measurement per day. I'm going to tell you what the science says. In the most recent years, probably like in the past 10 years, the amount of water that you should take in your day is half of your weight in ounces. Okay, so whatever your weight is, you take half of that, that's how many ounces you should drink. And because we wake up in a dehydrated state, you want to take at least 20 to 25 of that volume in the morning upon waking. So a big glass of water when you wake up. All right, here is a little chart I picked up online. This is your daily water intake. It's easy to do the math. You find out what your weight is in pounds, you take half of that, and that's how much water you should be drinking a day. All right, water helps all the tissues in our body because the majority of our body is made up of water. We want to be able to drink and stay hydrated, keep everything nice and loose in our body. All right, so this is important too because we think about ligaments, skin, tendons, all of that needs water to stay supple and loose. All righty, so let's see here. Another one is active recovery. Active recovery is not just taking a break or resting on days that you are not working out, right? Let's just say I go to the gym and I do a weight training session 3 times a week, ideally, not on consecutive days. All right, so you do get that in between time to rest, but those rest days should be active. We want to participate in some type of low impact movement practice, such as yoga, light stretching, walking, if that's the only thing that you can do, just so that we can stimulate blood flow and assist with lymphatic drainage. The lymph system is basically our plumbing system that gets rid of all these waste products in our body. It's a very passive system. So, I mean, if you've ever been on an airplane flight or sit for too long, or if you have circulatory issues, your lower body, your feet, your ankles might get swollen. And that's what happens with inactivity. And that's a sign of a, maybe dysfunctional lymphatic system. The only way to pump that fluid back into the central circulatory system is using a muscle contraction and relaxation. Veins in the lymphatic system, they function on the muscle's contraction and relaxation to pump the fluid out, especially against gravity, from our lower extremities up into our central circulatory system so our body can deal with it. So if you're dealing with swelling, you want to elevate your legs, your lower half of your body, at least higher than your heart level. So when I tell people that have like leg or ankle swelling, you can't just sit, put your feet up on the ottoman. It needs to be higher than your heart. And then once you get it higher than your heart, if you can do an ankle pump, start to move your foot up and down, that pumps the ankle muscles and the calf muscles, and that'll help to pump that fluid out of the lower body or out of the foot or ankle. And also, if you can compress that somehow and elevate it and move it, that's the best way to kind of get rid of that swelling. But after exercise and on rest days, we want to facilitate that proper lymphatic drainage by moving and stretching. All right. The other thing is stress management. All right. Stress management basically is an effect that happens on our central nervous system. We have 2 parts of our peripheral nervous system, the fight or flight, which is the sympathetic nervous system, and the rest and digest, which is the parasympathetic nervous system. Our body strives for a homeostasis, which is like you're in the middle, you can fight or flight when you need to, and rest and digest when you need to. Oftentimes, if we're under stress, we stay in this constant fight or flight response, and we get less exposure. Our body is less in the rest and digest phase, and that's important for recovery. So we need that homeostasis. And if you're feeling stress throughout the day, and this could be physical, emotional, or psychological stress, it doesn't matter. Your body doesn't know the difference. Your brain says, hey, I need to increase my heart rate, whatever, fight or flight response. And you could just be sitting there and your heart rate goes up because your peripheral nervous system says, I need to facilitate something. And we need to be able to rest and digest. So there's a lot of different ways to do that online. The easiest way we can do that to turn down the fight or flight response and get into a rest and digest phase is just deep breathing. All right, there's a lot of breathing patterns that you can do. We want to focus on belly breathing, in and out through the nose, not chest breathing, and maybe like a 2-second inhale and a 4-second exhale, right? So the exhale is longer than the inhale, right? So that can help reset your central nervous system, calm down your fight or flight response, and get you to recovery mode, all right? So active recovery, what does that look like? So I'm gonna pull out my 2-shot here, and we talked about movement practices, trying to get your body moving so that you keep all your tissues supple. So one of the first things I like to do is start off on all fours, right? So I got on the floor here. Now, if you can't get onto the floor, onto all fours, you could certainly get onto your bed or chair or table to get on all fours. This way, your body is super supported. And because it's supported, there's not a lot of stress on your spine, and then we could start to move from this position. Kind of like a cat camel, right? So this is kind of borrowed directly from yoga, just kind of going up and down, making the movement through our spine, getting our back to arch, our pelvis to rotate, our head and neck to move, right? So doing that for about maybe 5 or 10 times or 30 seconds, that helps to kind of stimulate the blood flow and get your body moving. And then we could start to go in bigger movements, right? So the other thing we could do is once we could start getting into this position, right, we can go into a cobra where we push things up, and then back into child's pose, which is a bigger movement of the lumbar and hip motion. And then once we can loosen that up, we can get into a groiner, which is kind of separating the feet, knees, and hips down. And then we move the hips forward and backward. So as I move forward and backward here, I'm just going through a range of motion that feels comfortable, flexing and extending my hip, getting a stretch through my hip and my glute here. And I can repeat on the other side. 30 seconds each, if the bare minimum, I think, through full range of motion as much as you can, right? And then we want to be able to extend through the hip too. If we sit a lot, our front part of our hip tends to get really sticky and bound down. We lose that ability to bring our knee behind our hip. So we want to get through this position, kind of like a little sun salutation, this half kneeling position. We bring the hands up, stretching the shoulders a little bit, and you're kind of just winging through it, just back and forth. And you can go back into the other side. This type of thing, this active recovery movement pattern or movement practice shouldn't take more than 3 to 5 minutes, right? So nice and easy. And then what was the other one I got lined up here? A glute stretch is also good if you're sitting. We can get into this position, just kind of crossing the leg over and then folding over here. So from the side, let me show you that. It's over here, crossing the leg over, and then just folding over. Now the key is we can make this very specific or non-specific. If I get into this position here, I just round out my back on my exhale. I'm getting a little bit of back stretch. I'm getting a little bit of hip stretch, right? So not very specific. If I want to make it specific for this glute, I lock down my back. I don't bend my back at all. I keep my back straight and I fold over the hip. If I stay tall and fold over the hip, that's all hip and not a lot of back stretch, right? If you wanted to go into more of a back stretch in sitting, you could always bend forward and simulate the child's pose position in sitting. Tuck your chin in, round out the shoulders, and then come back out of that position, all right? So the theme when you're doing an active recovery or movement practice is trying to get through a large range of motion comfortably though, right? So we don't want to create pain with a lot of these movement patterns. It's really easy to scale or modify these stretches so that you don't experience pain or injure yourself when you're getting into these stretches. Alrighty? All right, so let me pull up my shot here and let's kind of summarize everything we talked about. Sleep, hydration, right? Half of your body weight in ounces to drink, 7 to 8 hours of sleep, active recovery movement practices, and stress management, deep breathing techniques, etc. All right, so let me just check the chat here, see if we have any questions? All right. Any questions here? All right. Hopefully you all found this helpful for today for your quick, easy session. All right. Well, I'm going to give it a 20-second countdown here, and I'm going to close it out. All righty. Excellent. It's a nice day in New Jersey. Hopefully you get a chance to go outside, get mobile, get moving, stay hydrated. All right, get some vitamin D. All right, everybody. Thank you for joining me today. You could look for this session and many more on demand on any of the Better Spaces apps. I will be back next week, looks like. Yeah, looks like next week, Tuesday, April 23rd. We're going to be talking about injury prevention for golfers, strengthening and stretching techniques. We'll focus on proactive measures to prevent common injuries associated with golf, and we'll explore targeted strengthening exercises to improve core stability and enhance your swing mechanics, and specific strengthening techniques designed to increase flexibility and to reduce your risk of injury on the golf course. You know, whether you're a seasoned golfer or just getting started, the tips that I'll go over next week will keep you on the green and injury-free. All right. Any questions, you can email me here at paul@par5pt.com or team@betterspaces.com. Thank you for coming and be well. Bye-bye.